Loperamide should not be used in patients with Clostridium difficile infection as it can worsen the condition. So let's see how this happens. Loperamide is an anti-motility agent commonly used to reduce the frequency of diarrhea. It works by slowing down the peristalsis, that's gut movement, which increases water absorption in the intestine and helps reduce the number of bowel movements. However, loperamide should not be used in patients with Clostridium difficile infection for the following critical reasons. So 1. Risk of toxic megacolon. Toxic megacolon is a severe life-threatening complication of Clostridium difficile infection that involves extreme dilation of the colon and a reduction in bowel movement. When loperamide is used in Clostridium difficile patients, it can decrease intestinal motility way too much, leading to the colon becoming more distended. This decreases the ability of the colon to expel toxin and pathogen, thereby allowing the infection to worsen. So in essence, by slowing down bowel movements, loperamide may lead to a buildup of toxins in the colon, which can aggravate the condition, leading to toxic megacolon. This condition requires urgent medical attention and can result in colon perforation, sepsis, or even death if left untreated. 2. Delayed clearance of toxins. One of the hallmarks of Clostridium difficile infection is the production of toxins A and B. These toxins can damage the intestinal lining, leading to inflammation, diarrhea, and mucosal injury. Normally, the body attempts to clear Clostridium difficile toxins through increased bowel motility. By slowing this process, loperamide can delay the clearance of these toxins, which worsen the severity of the infection. The goal in treatment of Clostridium difficile infection is to eliminate or neutralize the bacteria and its toxins. Suppressing normal gut motility with loperamide interferes with this natural defense mechanism. Number 3. Worsening of symptoms and risk of complication. Loperamide can mask the symptoms of Clostridium difficile infection and delay appropriate diagnosis and treatment. The diarrhea caused by Clostridium difficile can actually be a way for the body to expel the harmful bacteria and toxins. By suppressing diarrhea with loperamide, the body is hindered in its natural effort to expel the pathogen, leading to worsened clinical outcomes. Additionally, bloody diarrhea or severe abdominal pain, which are red flags for Clostridium difficile infection, may be suppressed by loperamide, potentially leading to a delay in diagnosis and treatment. This could ultimately result in worsening of infection, including progression to sepsis. So the clinical guidelines for the management of Clostridium difficile infection recommend avoiding anti-motility agents like loperamide because they can worsen the condition. And the first step in treating Clostridium difficile infection is usually to discontinue the antibiotics that trigger the infection if it's appropriate. Vancomycin or fidaxomicin are typically used to target Clostridium difficile specifically. For some of us, we've only seen vancomycin. For managing diarrhea and preventing dehydration, oral rehydration solution (ORS) are the preferred treatment as they help replenish fluid and electrolyte loss due to diarrhea without exacerbating the condition. So also, if a patient presents with diarrhea after recent antibiotic use and there is suspicion of Clostridium difficile, pharmacists should refer the patient for stool testing. This is critical to confirm the diagnosis and allow for proper treatment, e.g. oral vancomycin. If a patient with Clostridium difficile infection is experiencing severe symptoms such as fever, dehydration, or severe abdominal pain, they should be referred immediately. In cases of severe infection, the patient might need to be hospitalized and treated with intravenous fluids and antibiotics. Know when to refer your patient as a pharmacist. So important note to healthcare workers: always give your best. Know when to refer. It will help you and also help the patient, and then to improve the patient's outcome. If you found this helpful, don't forget to like, share, and subscribe for more. See you in the next video. Thank you.